The dissection will be carried out on the left half of a brain which has been sectioned in the mid-sagittal plane. The first procedure to be performed is to make a transverse section through the midbrain, as has already been done in the specimen we are using, through the inferior colliculus. We see thus that part of the inferior colliculus will remain with the lower specimen, and the remainder will be seen in the upper specimen. The dissection will continue with the dissection of the upper specimen. At this stage, the meninges and the blood vessels should be stripped off the cerebral hemisphere. Be careful in doing so not to pull the vessels out of the anterior perforated substance, but rather to cut them with a scissors. Also, when reaching the region of the splenium of the corpus callosum, be careful not to damage the tela choroidea of the third ventricle. This is a fold of pyometer which lies between the fornix above and the thalamus below. And if one is not careful, one may damage it while stripping the membranes off the brain near the region of the posterior end of the corpus callosum. At this stage, if it has already not been done, it is convenient to make a study of the external features of the cerebral hemisphere. Our first dissection will have as its objective the exposure of the insula, an area of cortex which lies in the depths of the lateral fissure. In order to expose the insula, we shall have to remove its opercula. The opercula are 4 in number: the orbital, the frontoparietal, and the temporal. It is best for the beginner to try to remove these piecemeal. A suitable dissection instrument is a sharpened stick, and thus gradually one can take away the cerebral cortex which makes up the opercula and gradually approach the insula. And if one is careful, one should be able to expose the insula in its entirety without damaging it. The insula has now been partly exposed. Notice as the dissection proceeds that branches of the middle cerebral artery are found lying on the surface of the insula. These should be removed. It is convenient from time to time to wash the specimen in a bowl of water in order to remove the pieces of tissue which have already been dissected off. The dissection of the opercula has now been more or less completed, and we are able to see the entire insula. Please note that region of the insula called the limen, or threshold of the insula, which lies in the region of the stem of the lateral fissure. We shall have occasion a little later to refer specifically to this region of the insula. We shall now proceed to try and expose some of the association tracts. Association tracts are fibers which are made up of fibers which connect cerebral cortex of the same side of the brain, the same hemisphere. We shall start with the long association tracts. And the long association tract we shall try to dissect first is the superior longitudinal fasciculus. This connects the frontal with the occipital lobe and also the frontal with the temporal lobe. In order to expose these fasciculi, it is necessary to use the same dissection technique of scraping away cortex, and one starts by scraping the cortex lying above the region of the insula. And here one should gradually be able to expose the superior longitudinal fasciculus. More fibers of the superior longitudinal fasciculus are now visible, and we are almost ready to leave it for the moment to proceed with the inferior longitudinal fasciculus. However, before doing so, note that in the course of the dissection, one frequently comes across the short association fibers which run between adjoining gyri or between gyri which are not far from one another. These short association fibers are frequently referred to as the U fibers. We shall now go on to the inferior longitudinal fasciculus, and adopting the same technique, we shall scrape away the cortex of the temporal lobe and of the occipital lobe. This fasciculus runs between these two lobes from the occipital pole to the temporal pole. The fasciculus has now been reasonably well dissected, and a sufficient number of its fibers is exposed. The next association fasciculus to be dissected is the uncinate fasciculus, or the hook-like fasciculus, passing between the frontal lobe and the temporal lobe. The exposure of this fasciculus is slightly more difficult than that of the fasciculi we have so far dissected. It passes deep to the limen insulae, and if the dissection is started by carefully scraping away the cortex of the limen insulae, the dissection may be somewhat easier. We can now see most of the fasciculus. Notice how it hooks around the stem of the lateral sulcus, and in so doing lies deep to the limen insulae. The last association fasciculus which we shall study is the cingulum, or the girdle, which we shall approach from the medial surface of the hemisphere. It is located in the gyrus cinguli, or cingulate gyrus. If traced forwards, it will be found to pass around the anterior extremity of the corpus callosum into the subcallosal region towards the anterior perforated substance. Traced posteriorly, it will be found to enter the isthmus and the hippocampal gyrus, sometimes called the parahippocampal gyrus, and the uncus. Notice that it lies within a considerable portion of the limbic lobe. The dissection is best started in the gyrus cinguli as it lies above the body of the corpus callosum. Without much difficulty, the fasciculus may be exposed as it lies in the gyrus cinguli. The dissection has also proceeded to the anterior part of the fasciculus, where it winds round the anterior extremity of the corpus callosum into the subcallosal region. To complete the dissection, we now proceed to the region of the isthmus. So here then we see the cingulum lying in the isthmus, the hippocampal gyrus, and the uncus. We are now looking at the specimen again from the lateral aspect. Having dissected the association fibers, we shall now proceed to expose some of the projection fibers. These may be defined as fibers which pass from the cerebral cortex to lower parts of the central nervous system, and fibers which pass from lower parts of the nervous system to the cerebral cortex. We shall try to find them in that part of their course known as the corona radiata. To expose the corona radiata, we shall start by removing the fibers of the superior longitudinal fasciculus, both those which pass from the frontal to the occipital lobe and those which pass from the frontal to the temporal lobe. Again, the stick is a good dissecting instrument. Most of the fibers of the superior longitudinal fasciculus have now been removed, and we are able to see a considerable portion of the corona radiata. Notice how appropriate this name is. An important part of the corona radiata, which we have not yet exposed, is the optic radiation, which runs to the visual cortex in the occipital lobe. In order to expose the optic radiation, we shall remove the fibers of the inferior longitudinal fasciculus. The optic radiation lies deep to the fibers of the inferior longitudinal fasciculus, and therefore one has to exercise care when removing the fibers of the association fasciculus, because it is not always easy to see exactly where the fibers of the optic radiation come into view as one removes the more superficial fibers. However, it generally constitutes a well-defined band of straight fibers, and generally speaking, there is not a great deal of difficulty. And here is the optic radiation running to the striate cortex in the occipital lobe. We are now back on the medial surface of the hemisphere again. We shall leave the projection fibers for the time being and try to see some of the commissural fibers. These are fibers which join the right to the left hemisphere. Most of the commissural fibers are concentrated in the corpus callosum. On mid-sagittal section, we can notice the following parts of the corpus callosum: the body, anterior to the body, the genu or knee and the rostrum, and posterior to the body, the splenium. We shall start by following the fibers of the body of the corpus callosum. To do so, dissect laterally at the level of the upper surface of the body of the corpus callosum in a lateral direction. We shall have to remove the cingulum, which lies above the body of the corpus callosum, and also the cerebral cortex, which lies superior to the cingulum. Be bold in your dissection and remove the cerebral cortex and the cingulum without hesitation. The dissection has proceeded. Before examining what has been exposed, let us orient ourselves again on the mid-sagittal section, the rostrum of the corpus callosum, the genu, the body, and the splenium. The fibers of the body of the corpus callosum have been traced laterally, and in so doing, the corona radiata in its upper part has been largely removed. There is a special set of fibers of the corpus callosum which merits special mention. These fibers arise from the posterior part of the body of the corpus callosum and from part of the splenium. They are called, or they constitute, the tapetum, or the carpet. As they proceed laterally, instead of intersecting with fibers of the corona radiata, they pass medial to the corona radiata. Here we see how they pass medial to the optic radiation. In this region, we are close to the posterior horn of the lateral ventricle, which we shall see later on. You may recall that in order to expose the optic radiation, we removed the overlying inferior longitudinal fasciculus. Therefore, the lateral wall of the posterior horn of the lateral ventricle in this region is made up of the following from without inwards: the inferior longitudinal fasciculus, which we do not see here, the optic radiation, and the tapetum. This is clearly seen in this diagram, showing us a frontal section through the posterior horn of the lateral ventricle. And here we see, from without inwards, the inferior longitudinal fasciculus, the optic radiation, and the tapetum. To To complete our dissection of the corpus callosum, we still have to examine the fibers which pass through the region of the genu of the corpus callosum into the frontal lobe, and those which pass in the region of the splenium to the occipital lobe. We shall start with the former. These fibers, as they pass from one frontal lobe to the other frontal lobe, from one hemisphere to another, constitute what is known as the forceps minor. We shall be able to expose, of course, only one side of the forceps minor. To do so, one scrapes away the cerebral cortex of the medial surface of the frontal lobe, working at the level of the surface of the genu of the corpus callosum. The cortex has now been removed, and we can see the fibers of the forceps minor passing from the region of the genu into the frontal lobe. A similar dissection has already been carried out in the posterior region to demonstrate the forceps major or posterior forceps, the fibers passing from the region of the splenium into the occipital lobe. In carrying out this dissection, try not to destroy cerebral cortex lying below the level of the calcarine fissure. We are now looking at the medial surface of the hemisphere again, and as I perform three minor dissections. One, to separate the telechoroidea gently from the undersurface of the fornix, the body of the fornix. Secondly, using a scalpel to separate the body of the fornix from the undersurface of the corpus callosum. And thirdly, again using the scalpel to separate the septum pellucidum from the undersurface of the corpus callosum. And here this has been done. The forceps now lies between the septum pellucidum and the corpus callosum, now between the body of the fornix and the corpus callosum. Inferiorly, we see the telechoroidea, the double fold of pyometer, separated now from the undersurface of the body of the fornix. From here, we shall go on to open the lateral ventricle from the lateral aspect. Here we are looking at the lateral aspect of the specimen again. You will recall the optic radiation, which is related both to the temporal lobe and to the occipital lobe of the hemisphere. Our dissection starts by the introduction of a probe into the lower fibers of the optic radiation and through the optic radiation into the lateral ventricle. The probe is introduced in a plane about 1/4 of an inch anterior to the posterior end of the corpus callosum. From this point, It should then be drawn posteriorly while lying in the lateral ventricle, posteriorly in order to open up the posterior horn of the lateral ventricle, and anteriorly, again while lying in the ventricle, and anteriorly to open up the inferior horn of the lateral ventricle. After this, again noting the plane, 1/4 of an inch anterior to the posterior end of the splenium, the fibers of the optic radiation are cut across towards the corpus callosum, and the corpus callosum itself is also cut. This will be shown to you in a moment after the dissection has been carried out. The incisions have been made. Posteriorly, we see that the posterior horn has been opened up. Anteriorly, the inferior horn has been opened. We see the transverse incision across the fibers of the optic radiation, across the tapetum of the corpus callosum, and across the body of the corpus callosum in front of the splenium. I should have mentioned that in making the cut across the corpus callosum, care must be taken not to cut the body of the fornix, which earlier we separated from the undersurface of the corpus callosum. The next stage in the opening of the lateral ventricle will be to expose the central part or the body of the lateral ventricle a little more by taking off a portion of the body of the corpus callosum. Using a scissors, an incision is made from behind forwards, approximately 1/4 of an inch lateral to the midline. The incision should go forward, but should not go through the genu of the corpus callosum. It should stop short of the genu, and then the strip of corpus callosum thus made free should be removed. The portion of the corpus callosum to be removed has now been freed. Notice that to complete the freeing, a small transverse incision has been made just behind the genu. Removal of this piece of corpus callosum exposes the central part or the body of the lateral ventricle, and amongst other things, we can now see the choroid plexus of the lateral ventricle lying on the floor. The exposure may be improved by introducing a scissors under the lateral part of the corpus callosum and removing yet another strip. This dissection also exposes the anterior horn of the lateral ventricle. If necessary, a further portion of the body of the corpus callosum may be removed in order to improve the exposure of the anterior horn. A thorough study should now be made of the body and the anterior horn of the lateral ventricle. Only one feature will be demonstrated specifically here, and that is the choroid fissure. To reach the choroid fissure, introduce the probe into the transverse fissure which lies inferior to the corpus callosum, inferior to the splenium of the corpus callosum, pass the probe forward in the space in which the telechoroidea of the third ventricle lies, push the probe further under the body of the fornix and try to see the probe emerging beneath the margin of the fimbria of the fornix. It is through this fissure, known as the choroid fissure, that invagination of the ependyma takes place in the formation of the choroid plexus. This part of the choroid fissure is the part which is related to the body of the lateral ventricle. In order to obtain a better view of the posterior and the inferior horns of the lateral ventricle, we shall now divide the whole specimen into two parts. As a preliminary, gently separate the choroid plexus from the lateral margin of the fimbria at the choroid fissure. We might take this opportunity of mentioning or emphasizing that the choroid fissure lies between the lateral margin of the fimbria above and the thalamus below. An incision must now be made through the body of the fornix immediately posterior to the interventricular foramen. Turning the specimen over, the tissue lying anterior and above the extreme anterior tip of the inferior horn of the lateral ventricle must be torn through, and then it will be possible to remove the whole of this lower and posterior segment of the specimen. Next comes the dissection of the lentiform nucleus and the internal capsule. In order to obtain good orientation again, the two parts of the specimen have been reunited temporarily. In order to see the lentiform nucleus, we shall scrape away the insula and later on the white matter deep to the insula. This diagram, a horizontal section through the hemisphere, will show us diagrammatically the structures through which we have to pass in order to reach the lateral surface of the lentiform nucleus. Here we have the insula. Deep to the insula, the external capsule, within which lies the claustrum. Sometimes the portion of white matter lying lateral to the claustrum is called the extreme capsule. After the insula has been scraped away, one may see the claustrum. But generally speaking, this is such a thin and irregular stripe of gray matter that it is not easy to make it out definitely. We shall therefore not attempt to try and find it particularly. And we shall proceed straight down to the lateral surface of the lentiform nucleus. Vessels which proceed to the lentiform nucleus and coming up from the anterior perforated substance lie on its lateral surface. Sometimes these are seen very clearly, and if so, may be a useful guide to the lateral surface of the lentiform nucleus. We now go back to the specimen. We remove the lower and posterior part and proceed to the dissection of the insula, scraping away carefully as we did before. The insula has now been removed, and the deepest fibers of the external capsule are being scraped away. The outer convex surface of the lentiform nucleus is beginning to appear. Notice the fibers of the uncinate fasciculus. These may gradually be taken away, but in doing so, be careful not to damage the fibers of the anterior commissure, which pass to the temporal lobe. These, I hope, will be seen clearly later on. The lateral surface of the lentiform nucleus is now completely exposed. Note the relationship of the corona radiata to the lentiform nucleus. Notice also the fibers of the anterior commissure entering the temporal lobe. Before proceeding to a dissection of the internal capsule, which lies medial to the lentiform nucleus, it is advisable to try and demonstrate the continuity between the lentiform nucleus, more correctly the outer part of the lentiform nucleus, the putamen of the lentiform nucleus, with the head of the caudate nucleus. This diagram will help us understand this continuity. This is a frontal section through the anterior part of the lentiform nucleus. Once again, we see the insula, the claustrum lying in the external capsule, the lentiform nucleus, which is here shown continuous with the head of the caudate nucleus, which forms the lateral wall of the anterior horn of the lateral ventricle. To demonstrate this continuity, we shall dissect inferiorly and remove the cortex and white matter lying superficial to the zone of junction of the two nuclei, then work our way through the floor of the anterior horn, which in fact here is the rostrum of the corpus callosum, and show the direct continuity with the head of the caudate nucleus. Notice that the white matter here situated between the lentiform nucleus and the head of the caudate nucleus is the anterior limb of the internal capsule. The continuity between the two nuclei is a reminder of the common embryological origin of these two nuclei. At one stage in embryonic development, they were one continuous mass of gray matter. It was only when the internal capsule developed and the fibers of the internal capsule grew into the mass of gray matter that the nucleus was divided into two parts, a lateral part, the lentiform nucleus, and a medial part, the caudate nucleus. The dissection has been carried out in the specimen. Once again, the lateral surface of the lentiform nucleus, and here the continuity between the lentiform and the head of the caudate nucleus. While doing this dissection, you may come across small vessels which have come up from the region of the anterior perforated substance, the so-called striate vessels, some of which penetrate into the lentiform nucleus and some of which proceed round its lateral surface. Pay particular attention to these. They are small but most important. Once again, to try and study the continuity between the two nuclei, pass the probe into the anterior horn through the floor of the horn. Turning the specimen round, we may be able to observe the probe entering the anterior horn of the ventricle through the floor. Here is the head of the caudate nucleus, and the continuity between the two nuclei may then be clearly observed. This bulge is the head of the caudate nucleus. Going back to the inferior surface, notice once again the fibers of the anterior commissure. These fibers pass transversely through the zone of union of the two nuclei. A little dissection brings it into view. Once again, notice here the lentiform nucleus, its continuity inferiorly with the head of the caudate nucleus, and this artificial gap which we see is located in the floor of the anterior horn of the lateral ventricle. The fibers of the anterior commissure are clearly seen passing through the zone of junction of the two nuclei and spreading out in the temporal lobe. The removal of the lentiform nucleus may be carried out by scraping it away piecemeal, or by removing it in one piece. The latter type of dissection is more difficult. If one wishes to carry it out, the best way is to insert a flattened wooden stick or the handle of a scalpel between the nucleus and the fibers of the internal capsule. I shall try to remove the nucleus in one piece in this specimen. The dissection has been carried out, the nucleus has been freed, and here it is being removed in one piece. We may now see the fibers of the internal capsule and observe their continuity with the corona radiata. Notice again the fibers of the anterior commissure. I should like to show you a second specimen in which the dissection has been carried out in a slightly different manner. The nucleus has been removed piecemeal. We see the internal capsule. Once again, its continuity with the corona radiata. Particularly well seen in this specimen is the optic radiation, and we can see the fibers of Mayer's loop exceptionally well as they sweep into the temporal lobe before proceeding posteriorly to the occipital lobe. Also well seen is the continuity of the fibers of the internal capsule with those of the basis pedunculi of the midbrain. Notice how the optic tract winds round the basis pedunculi. By inserting a probe deep to the optic tract and passing it upwards, one may observe the continuity between the internal capsule and the basis pedunculi. A similar procedure may be carried out on your own specimen. Here we see a transverse section through the midbrain, the basis pedunculi, the optic tract. Place the probe between the optic tract and the basis pedunculi, pass it upwards, and the continuity of the fibers of the two structures may then be clearly observed. We return to the optic tract again to observe some of the structures connected with the visual system. Here is the optic nerve, the optic chiasma, the optic tract, the lateral geniculate body, and the superior colliculus of the midbrain.
It is worthwhile here to review the fact that the brachium of the superior colliculus branches medially from the optic tract at the level of the rostral midbrain toward its termination in the pretectal area and the superior colliculus.
Frequently, this structure cannot be seen unless a little dissection is carried out. This may be done quite simply by scraping away the tissue that lies in between the lateral geniculate body and the superior colliculus, and the superior brachium should then be exposed. This will now be done in this specimen.
This bundle leaves the medial aspect of the optic tract, courses medially and around the medial geniculate body to continue medially and terminate in the rostral midbrain at the level of the superior colliculus. These fibers can be seen quite nicely in this specimen.